Question 1. A 68-year-old male complains of sudden onset of crushing chest pain that radiates to his left arm and jaw. He is pale, diaphoretic, and states he feels lightheaded. His vital signs are BP 90/60 mmHg, HR 110 bpm, RR 22 bpm, SpO2 94% on room air. What is the most appropriate initial management for this patient if local protocols allow? A. Administer 324 mg aspirin and assist with nitroglycerin. B. Transport immediately without interventions. C. Place the patient in a supine position and administer high-flow oxygen. D. Administer oral glucose and reassess blood pressure. Answer: A. Administer 324 mg aspirin and assist with nitroglycerin. This question tests your knowledge of acute coronary syndrome, ACS, management, with keywords like crushing chest pain, radiates to left arm and jaw, and pale, diaphoretic, strongly suggesting a cardiac event. Administering aspirin, 324 mg chewed, is crucial for its antiplatelet effects to prevent clot enlargement, while assisting with nitroglycerin, if the patient meets contraindications, like a low blood pressure of 90/60 mm of mercury here, which would be a contraindication for nitroglycerin. But the question asks if local protocols allow, implying you consider the best initial set of interventions, and nitroglycerin is part of cardiac chest pain management when BP allows, helps with vasodilation to reduce cardiac workload and pain. For example, you would only administer nitroglycerin if the patient's systolic blood pressure remains above 100 mm of mercury, or as per local protocol. Otherwise, aspirin alone would be appropriate before transport. Always prioritize interventions that directly address the underlying cardiac issue and improve myocardial perfusion, while continuously monitoring vital signs. Question 2. When ventilating an apneic adult patient with a bag valve mask, BVM, device, what is the most appropriate rate and volume to deliver breaths? A. 10 to 12 breaths per minute, just enough volume to cause visible chest rise. B. 20 to 24 breaths per minute, delivering full compression of the bag. C. 6 to 8 breaths per minute, using minimal volume to avoid hyperinflation. D. As fast as possible, ensuring rapid chest rise and fall. Answer: A. 10 to 12 breaths per minute, just enough volume to cause visible chest rise. This question assesses proper BVM ventilation technique for an apneic adult, emphasizing the importance of rate and tidal volume. The keywords apneic adult and bag valve mask point to the need for effective artificial ventilation. The correct approach is to deliver breaths at a rate of 10 to 12 per minute, approximately one breath every 5 to 6 seconds, using just enough volume to achieve visible chest rise, avoiding overventilation, which can lead to gastric insufflation, vomiting, and decreased cardiac output. For instance, when providing breaths, watch for the chest to gently rise, then stop squeezing the bag, waiting for the appropriate interval before the next breath. Remember that quality ventilation is about providing adequate oxygenation and ventilation without causing harm from excessive pressures or volumes. Question 3. You are on scene with a patient who has sustained a severe laceration to the forearm, resulting in uncontrolled arterial bleeding. Direct pressure and elevation have failed to stop the hemorrhage. What is the most appropriate next step? A. Apply a tourniquet proximal to the injury. B. Apply a pressure dressing to the wound. C. Pack the wound with hemostatic gauze. D. Continuously apply direct pressure with additional dressings. Answer: A. Apply a tourniquet proximal to the injury. This question focuses on critical hemorrhage control techniques, particularly when initial measures fail. The keywords severe laceration, uncontrolled arterial bleeding, and direct pressure and elevation have failed are vital clues, indicating a life-threatening hemorrhage that requires aggressive intervention. Applying a tourniquet proximal, closer to the body's core, to the injury is the definitive next step for uncontrolled extremity bleeding that does not respond to direct pressure. For example, if the bleeding is on the lower arm, apply the tourniquet high on the upper arm to occlude arterial flow effectively. Remember, stopping life-threatening bleeding is a top priority, and a properly applied tourniquet is a highly effective, rapid intervention for this purpose. Question 4. Upon approaching a motor vehicle collision, you observe gasoline leaking from one of the vehicles and down power lines across the scene. What is your immediate priority? A. Begin patient assessment and initiate care. B. Establish a safe zone and request appropriate resources. C. Direct traffic away from the scene. D. Don personal protective equipment, PPE, and approach the vehicles. Answer: B. Establish a safe zone and request appropriate resources. This question tests your understanding of scene safety, which is always the absolute first priority in emergency medical services. The keywords gasoline leaking and down power lines highlight significant immediate hazards that pose a threat to both rescuers and patients. Before any patient contact or intervention, establishing a safe zone by staying clear of hazards and requesting specialized resources like fire department or power company is paramount. For example, if you see down power lines, stay at least one utility pole span away until the power is confirmed off and the scene is declared safe. Your safety, the crew's safety, and bystander safety must be ensured before you can effectively help any patients. Question 5. A 45-year-old male is found unresponsive. His family states he is a known diabetic and hasn't eaten all day. His skin is cool, pale, and clammy. His blood glucose level, BGL, is 45 milligrams per deciliter. What is the most appropriate initial intervention? A. Administer oral glucose. B. Administer 50% dextrose, D50, intravenously. C. Initiate rapid transport to the nearest hospital. D. Administer glucagon intramuscularly. Answer: A. Administer oral glucose. This question assesses the management of hypoglycemia in an unresponsive patient with a low blood glucose. The key phrases unresponsive, known diabetic, hasn't eaten all day, cool, pale, and clammy skin, and BGL 45 milligrams per deciliter are classic indicators of severe hypoglycemia. For an unresponsive patient with a palpable gag reflex, oral glucose is the appropriate first-line treatment if they can safely swallow, as it is rapidly absorbed. However, if the patient is truly unresponsive and cannot protect their airway, D54 or glucagon IM would be indicated. For example, if the patient is only slightly altered but can follow commands, oral glucose paste under the tongue is a safe and effective option. Always remember to prioritize airway protection in any patient with altered mental status. Question 6. Your patient is a 32-year-old female complaining of a severe asthma attack. She is alert but in significant respiratory distress, wheezing loudly, and unable to speak in full sentences. She has a prescribed albuterol metered dose inhaler, MDI. After oxygen administration, what is the most appropriate next step if protocols allow? A. Assist the patient in administering her albuterol MDI. B. Administer oral prednisone. C. Transport immediately without further intervention. D. Administer a rapid intravenous fluid bolus. Answer: A. Assist the patient in administering her albuterol MDI. This question tests your knowledge of asthma exacerbation management, particularly the use of bronchodilators. The keywords severe asthma attack, respiratory distress, wheezing loudly, and prescribed albuterol MDI clearly indicate the need for bronchodilator therapy. After ensuring adequate oxygenation, assisting the patient with their prescribed albuterol MDI is the most appropriate initial pharmacological intervention for acute bronchospasm, as albuterol quickly relaxes the smooth muscles of the airways, opening them up. For instance, ensure the patient shakes the inhaler, exhales fully, and inhales slowly and deeply as they activate the device, holding their breath for a few seconds if possible. Providing this crucial medication promptly can significantly improve the patient's breathing and reduce their distress. Question 7. A 24-year-old male fell approximately 15 feet from a ladder, landing on his head. He is unconscious, opens his eyes only to painful stimuli, makes incomprehensible sounds, and extends his extremities in response to pain. What is his Glasgow Coma Scale, GCS, score? A. 3. B. 5. C. 7. D. 9. Answer: C. 7. This question assesses your ability to accurately calculate a Glasgow Coma Scale, GCS, score, a critical assessment tool for neurological status. The keywords unconscious, opens his eyes only to painful stimuli, makes incomprehensible sounds, and extends his extremities in response to pain provide the necessary components for calculating the GCS. For eye-opening to pain, the score is 2, for incomprehensible sounds, the score is 2, and for abnormal extension, decerebrate posturing, to pain, the score is 2. Adding these scores, 2 plus 2 plus 3, yields a total GCS of 7. Remembering the individual components of the GCS and their corresponding scores, such as how decerebrate posturing equals a motor score of 2, is crucial for correctly assessing a patient's neurological condition. Question 8. You are assessing a 6-month-old infant who is presenting with signs of severe respiratory distress, including nasal flaring, grunting, and retractions. The infant's heart rate is 50 bpm. What is your immediate priority? A. Administer supplemental oxygen via nasal cannula. B. Begin chest compressions. C. Assess for a foreign body airway obstruction. D. Initiate positive pressure ventilation with a BVM. Answer: D. Initiate positive pressure ventilation with a BVM. This question tests your understanding of critical pediatric respiratory and circulatory emergencies. The keywords severe respiratory distress, nasal flaring, grunting, and retractions, and especially heart rate is 50 bpm are crucial. In infants and children, bradycardia, slow heart rate, is most commonly a sign of severe hypoxia, low oxygen, indicating imminent respiratory arrest. Therefore, positive pressure ventilation with a BVM is the immediate priority to provide oxygen and improve ventilation, which will likely increase the heart rate. For example, if an infant's heart rate drops below 60 bpm despite adequate oxygenation and ventilation, then chest compressions would be initiated along with ventilation, but ventilation is the initial step for hypoxia-induced bradycardia. Always remember that in pediatric patients, hypoxemia is the primary cause of cardiac arrest, and addressing airway and breathing is paramount. Question 9. You are caring for a conscious and alert 40-year-old male who has sustained an isolated fracture to his left forearm. He initially agrees to treatment but then states he wants to refuse transport to the hospital. What is the most appropriate action? A. Respect his decision and leave the scene after documenting. B. Inform him that you must transport him due to the severity of the injury. C. Clearly explain the potential risks of refusing transport and document his refusal thoroughly. D. Contact medical control immediately for a mandatory transport order. Answer: C. Clearly explain the potential risks of refusing transport and document his refusal thoroughly. This question centers on the legal and ethical concept of a patient's right to refuse medical care. The keywords conscious and alert, agrees to treatment but then states he wants to refuse transport, and isolated fracture indicate a patient who appears to have decisional capacity. The most appropriate action is to ensure the patient fully understands the potential consequences of refusing transport, including worsening of his condition, infection, or long-term disability, and then thoroughly document this discussion and his refusal. For instance, explain that an untreated fracture could lead to permanent deformity or nerve damage. It is critical to respect a patient's autonomy while ensuring they are fully informed of the risks before leaving the scene without transport. Question 10. A 72-year-old patient with a history of COPD is experiencing acute shortness of breath. His respirations are shallow at 26 breaths per minute, and his SpO2 is 88% on room air. What is the most appropriate oxygen administration method for this patient? A. Non-rebreather mask at 15 liters per minute. B. Nasal cannula at 2 to 4 liters per minute. C. Bag valve mask ventilations. D. Continuous positive airway pressure, CPAP. Answer: D. Continuous positive airway pressure, CPAP. This question evaluates your understanding of respiratory management, particularly in patients with chronic obstructive pulmonary disease, COPD, experiencing acute exacerbations. The keywords COPD, acute shortness of breath, shallow respirations at 26 breaths per minute, and SpO2 is 88% on room air suggest significant respiratory distress and hypoxia. While supplemental oxygen is necessary, CPAP is often the most appropriate and effective intervention for COPD exacerbations, as it provides continuous positive pressure, which helps to keep the alveoli open, reduces the work of breathing, and can improve oxygenation and ventilation without intubation. For example, CPAP can help splint the airways open and push fluid back into the vasculature, making it easier for the patient to breathe and improving gas exchange. Question 11. Your patient is an unrestrained driver involved in a high-speed frontal impact collision. She complains of neck and back pain and has altered mental status. What is the most important initial spinal immobilization consideration? A. Applying a cervical collar and long backboard. B. Maintaining manual inline stabilization of the head and neck. C. Assessing for distal pulses and motor function before moving. D. Rapidly extricating the patient to a safe environment. Answer: B. Maintaining manual inline stabilization of the head and neck. This question focuses on critical initial steps in managing potential spinal injuries in trauma patients. The keywords unrestrained driver, high-speed frontal impact collision, neck and back pain, and altered mental status are strong indicators of a high likelihood of spinal trauma. The most important initial spinal immobilization consideration is to maintain manual inline stabilization of the head and neck immediately upon contact with the patient, even before assessing vital signs or applying a cervical collar. For instance, one rescuer should hold the patient's head in a neutral, inline position while the primary assessment is performed. This action prevents further movement of the spine and minimizes the risk of exacerbating a potential spinal cord injury. Question 12. When assessing an elderly patient who fell, you notice multiple bruises at various stages of healing and signs of poor hygiene. The patient seems withdrawn and hesitant to speak. What should be your primary concern? A. The patient is likely confused due to the fall. B. The patient may be experiencing elder abuse or neglect. C. The patient has an underlying medical condition causing the falls. D. The patient requires immediate transport for psychiatric evaluation. Answer: B. The patient may be experiencing elder abuse or neglect. This question addresses the important topic of recognizing signs of elder abuse or neglect, which is a critical consideration in patient assessment. The keywords elderly patient, multiple bruises at various stages of healing, signs of poor hygiene, withdrawn, and hesitant to speak are significant red flags for potential abuse or neglect. While other medical conditions might be present, these specific findings strongly suggest the need to consider and document suspected abuse or neglect, following local protocols for reporting. For example, observe if the patient seems fearful of a caregiver present or if explanations for injuries don't match the findings. Your primary concern should be the patient's safety and well-being beyond the immediate medical complaint, and reporting suspected abuse is often a legal requirement. Question 13. A patient presents with cool, clammy skin, a rapid weak pulse, and hypotension following a significant traumatic injury with apparent external bleeding. What is the most likely type of shock this patient is experiencing? A. Neurogenic shock. B. Anaphylactic shock. C. Cardiogenic shock. D. Hypovolemic shock. Answer: D. Hypovolemic shock. This question tests your ability to identify different types of shock based on presenting signs and symptoms and mechanism of injury. The keywords cool, clammy skin, rapid weak pulse, hypotension, significant traumatic injury, and apparent external bleeding are classic indicators of hypovolemic shock. Hypovolemic shock is caused by a significant loss of blood or other body fluids, leading to inadequate tissue perfusion. For example, a patient who has lost a substantial amount of blood from a deep laceration will exhibit these signs as their body attempts to compensate for the fluid loss. Recognizing these key signs helps you prioritize immediate interventions to control bleeding and support circulation. Question 14. You are called to a construction site for a 35-year-old male who collapsed while working in direct sunlight. He is unconscious, his skin is hot and dry, and his core body temperature is estimated to be very high. What is your immediate priority for this patient? A. Administer oral rehydration solution. B. Actively cool the patient. C. Administer high-flow oxygen via non-rebreather mask. D. Initiate immediate transport to the nearest hospital. Answer: B. Actively cool the patient. This question focuses on the emergency management of heat stroke, a life-threatening environmental emergency. The keywords collapsed while working in direct sunlight, unconscious, and skin is hot and dry are hallmark signs of heat stroke, indicating a failure of the body's thermoregulatory system. The immediate priority is active cooling of the patient to rapidly lower their core body temperature and prevent further organ damage. For example, remove excess clothing, spray with cool water, and apply cold packs to the neck, armpits, and groin. While transport is important, aggressive on-scene cooling significantly improves patient outcomes in heat stroke. Question 15. During a full-term pregnancy, a patient experiences a sudden onset of severe abdominal pain and bright red vaginal bleeding. Upon assessment, you note a rigid, board-like abdomen. The patient is hypotensive and tachycardic. What is the most likely cause of her symptoms? A. Ectopic pregnancy. B. Placenta previa. C. Abruptio placentae. D. Preeclampsia. Answer: C. Abruptio placentae. This question assesses your understanding of obstetric emergencies during late pregnancy. The keywords full-term pregnancy, sudden onset of severe abdominal pain, bright red vaginal bleeding, and particularly rigid, board-like abdomen are classic signs of abruptio placentae. This condition occurs when the placenta prematurely separates from the uterine wall, causing internal bleeding, which makes the abdomen rigid, and potentially external bleeding. For example, unlike placenta previa, where bleeding is typically painless, abruptio placentae presents with significant pain dural contraction. Prompt recognition and rapid transport are crucial for both maternal and fetal survival. Question 16. A 28-year-old female is experiencing a severe allergic reaction after being stung by a bee. She is covered in hives, complaining of difficulty breathing, and her voice is hoarse. Her blood pressure is 80/40 mmHg, and her heart rate is 120 bpm. What is the most appropriate initial medication to administer? A. Diphenhydramine, Benadryl. B. Albuterol via nebulizer. C. Epinephrine autoinjector. D. Dexamethasone. Answer: C. Epinephrine autoinjector. This question tests your knowledge of anaphylaxis management, focusing on the appropriate immediate medication. The keywords severe allergic reaction, difficulty breathing, hoarse voice, hives, and especially blood pressure is 80/40 mmHg indicate a life-threatening anaphylactic reaction involving both respiratory compromise and cardiovascular collapse. Epinephrine is the immediate and most critical medication for anaphylaxis, as it causes vasoconstriction to raise blood pressure and bronchodilation to improve breathing. For instance, if the patient has a prescribed autoinjector, assist them in administering it without delay into the lateral thigh. Administering epinephrine promptly can be life-saving by reversing the profound physiological effects of anaphylaxis. Question 17. You are managing an unconscious patient with a suspected opioid overdose. Despite airway adjuncts and proper positioning, they remain apneic. What is the most effective method to ensure adequate ventilation? A. Nasal cannula at 6 liters per minute. B. Non-rebreather mask at 15 liters per minute. C. Bag valve mask, BVM, ventilations. D. Oral pharyngeal airway and spontaneous breathing. Answer: C. Bag valve mask, BVM, ventilations. This question assesses your ability to manage an apneic patient, particularly in the context of an opioid overdose. The keywords unconscious, suspected opioid overdose, and remain apneic clearly indicate the need for artificial ventilation because the patient is not breathing effectively on their own. While airway adjuncts help maintain an open airway, the most effective method to ensure adequate ventilation for an apneic patient is positive pressure ventilation using a BVM device. For example, once the airway is open, providing a breath every 5 to 6 seconds for an adult with the BVM will deliver oxygen and remove carbon dioxide, preventing respiratory arrest. Relying on spontaneous breathing or passive oxygen delivery methods is insufficient for an apneic patient. Question 18. You arrive on scene to find an adult patient who collapsed and is pulseless and apneic. High-quality cardiopulmonary resuscitation, CPR, has been initiated by bystanders. What is the most appropriate next action for your crew? A. Administer 2 rescue breaths. B. Assess for a pulse for 30 seconds. C. Attach the automated external defibrillator, AED, and follow its prompts. D. Begin intravenous access and fluid administration. Answer: C. Attach the automated external defibrillator, AED, and follow its prompts. This question tests your understanding of the immediate priorities in cardiac arrest management, specifically when high-quality CPR is already in progress. The keywords collapsed, pulseless and apneic, and high-quality CPR has been initiated by bystanders are crucial. When CPR is ongoing, the most appropriate next action is to rapidly attach and utilize the AED, as early defibrillation is a critical component of the chain of survival for many cardiac arrest rhythms. For example, while one rescuer continues chest compressions, another should prepare and apply the AED pads. The AED will analyze the heart rhythm and advise if a shock is indicated, significantly increasing the chances of survival from a treatable rhythm like ventricular fibrillation. Question 19. A 60-year-old male presents with sudden onset of weakness and numbness to his right arm and leg. He has facial droop on the right side and is slurring his speech. He is alert and oriented to person only. What is the most important information to obtain regarding this patient? A. His full medical history. B. The exact time the symptoms began. C. His preferred hospital for transport. D. Any family history of similar events. Answer: B. The exact time the symptoms began. This question focuses on critical information gathering for a patient exhibiting signs of a stroke. The keywords sudden onset, weakness and numbness to his right arm and leg, facial droop on the right side, and slurring his speech are classic indicators of a cerebrovascular accident, stroke. The most important information to obtain is the exact time the symptoms began, as this last known normal time is crucial for determining eligibility for time-sensitive treatments like thrombolytic therapy or endovascular thrombectomy at the hospital. For example, asking when was the patient last seen completely normal helps the hospital determine if clot-busting medications can be given. Time is brain in stroke management, making this a paramount piece of information for optimal patient outcome. Question 20. Your patient has full-thickness burn circumferential to his left arm. The skin is charred, dry, and painless. What is the immediate concern for this patient's burned extremity? A. Increased risk of infection due to the open wound. B. Potential for nerve damage and permanent disability. C. Development of compartment syndrome. D. Need for immediate skin grafting. Answer: C. Development of compartment syndrome. This question tests your understanding of critical complications associated with severe burns. The keywords full-thickness burns, circumferential to his left arm, and charred, dry, and painless describe a severe, deep burn that completely encircles a limb. A circumferential full-thickness burn is a significant concern because as the burn progresses, the damaged tissue swells, and the inflexible eschar, burned skin, can act like a tourniquet, compromising circulation and leading to compartment syndrome, a limb-threatening condition. For example, as the arm swells, pressure within the muscle compartments increases, restricting blood flow and potentially causing nerve and muscle damage. Recognizing this immediate risk is vital for early intervention, such as escharotomy, which may be needed at the hospital to relieve pressure. Question 21. When communicating with medical control, what is the most effective approach to ensure clear and concise information exchange? A. Give a detailed narrative of the entire scene and patient history. B. Use the SBAR, situation, background, assessment, recommendation, format. C. Focus primarily on the patient's chief complaint. D. Limit communication to yes or no answers. Answer: B. Use the SBAR, situation, background, assessment, recommendation, format. This question focuses on effective communication with medical control, a crucial aspect of pre-hospital care. The phrase clear and concise information exchange is key, indicating the need for a structured and efficient reporting method. The SBAR, situation, background, assessment, recommendation, format provides a standardized framework for communicating critical information in a concise yet comprehensive manner, ensuring all pertinent details are conveyed systematically. For instance, you would state the situation, example, we have a 70-year-old female with chest pain, then background, example, history of CAD, taken 3 nitros, assessment, example, BP 90/60, HR 110, pain 8/10, and finally recommendation, example, requesting permission for aspirin and 12-lead ECG. This standardized approach minimizes miscommunication and facilitates efficient medical direction. Question 22. A 55-year-old male with a history of alcohol abuse is found unconscious with small respirations and a fruity odor on his breath. His blood glucose is 450 milligrams per deciliter. What is the most likely cause of his altered mental status? A. Hypoglycemia. B. Alcohol intoxication. C. Diabetic ketoacidosis, DKA. D. Stroke. Answer: C. Diabetic ketoacidosis, DKA. This question assesses your ability to differentiate causes of altered mental status, particularly in a patient with a history of alcohol abuse. The keywords unconscious, small respirations, deep, rapid breathing, fruity odor on his breath, and blood glucose is 450 milligrams per deciliter are classic signs and symptoms of diabetic ketoacidosis, DKA. DKA occurs when the body produces high levels of blood acids called ketones because it cannot produce enough insulin. For example, small respirations are the body's attempt to blow off excess carbon dioxide to compensate for metabolic acidosis, and the fruity breath odor is due to acetone, a type of ketone. Recognizing these distinct findings guides your pre-hospital management, even though the definitive treatment will occur at the hospital. Question 23. You are called to a private residence for a 28-year-old male found unresponsive with pinpoint pupils and slow, shallow respirations at 6 breaths per minute. What medication should you anticipate administering? A. Activated charcoal. B. Naloxone. C. Atropine. D. Oral glucose. Answer: B. Naloxone. This question tests your recognition and management of an opioid overdose. The keywords unresponsive, pinpoint pupils, and slow, shallow respirations at 6 breaths per minute are classic hallmarks of opioid toxicity, causing profound respiratory depression. Naloxone is the specific antidote for opioid overdose, rapidly reversing its effects by blocking opioid receptors. For example, administering naloxone intranasally or intramuscularly can quickly restore the patient's spontaneous breathing. Prompt administration of naloxone is a critical, potentially life-saving intervention for patients experiencing an opioid-induced respiratory arrest. Question 24. A patient has a penetrating injury to the chest wall with an open, sucking wound. Upon assessment, you hear air moving in and out of the wound with each breath. What is the most appropriate initial intervention? A. Administer high-flow oxygen and transport immediately. B. Apply an occlusive dressing taped on 3 sides. C. Apply direct pressure to the wound. D. Cover the wound with a bulky dressing and bandage tightly. Answer: B. Apply an occlusive dressing taped on 3 sides. This question focuses on the immediate management of an open pneumothorax, also known as a sucking chest wound. The keywords penetrating injury to the chest wall, open, sucking wound, and hear air moving in and out of the wound with each breath indicate a life-threatening injury where air is entering the pleural space through the chest wall, causing lung collapse. The most appropriate initial intervention is to apply an occlusive dressing, such as an airtight dressing, taped on 3 sides, creating a flutter valve effect. For example, as the patient inhales, the dressing seals the wound, preventing air from entering, but as they exhale, the untapped side allows trapped air to escape, preventing a tension pneumothorax. This intervention seals the wound while allowing for pressure relief. Question 25. What is the primary purpose of thorough and accurate documentation in EMS? A. To satisfy legal requirements for billing. B. To protect the EMS provider from lawsuits. C. To provide a clear and concise medical record for continuity of patient care. D. To justify the need for additional resources on scene. Answer: C. To provide a clear and concise medical record for continuity of patient care. This question assesses the fundamental purpose of comprehensive documentation in EMS. While legal and billing aspects are considerations, the primary purpose of thorough and accurate documentation is to ensure seamless continuity of patient care. A well-written patient care report, PCR, provides vital information to subsequent healthcare providers, allowing them to understand the patient's condition, the care provided, and the patient's response to treatment. For example, a detailed PCR helps emergency department staff quickly grasp the patient's history, vitals, and interventions performed, preventing redundant assessments and facilitating appropriate ongoing treatment. Always remember that your documentation serves as a critical communication tool that directly impacts the patient's well-being beyond your immediate care.